Every time you go to the doctor, they take your blood pressure. That's because it's an important part of your health. It used to be something that only was done in a doctor's office, but now many people have machines just like this at home.
And it's a good thing to have because it's good to give your doctors an accurate measurement, what you get at home when you go visit with them. But are we doing it right? That's why we have our 9 News medical expert and cardiologist, Dr. Payal Kohli, here to show us the do's and the don'ts.
You take blood pressure 20 times a day? Everybody?
More than that, hundreds of times a day, Tom. And I feel like we can't emphasize it enough because waiting to check your blood pressure just at the doctor's office is missing all those days in between. And blood pressure is called a silent killer because it sneaks up on you. It often starts to go up and you don't even realize it. So I often tell my patients our skin ages with wrinkles, our blood vessels age by getting stiffer. So it's natural for our blood pressure to go up even if it hasn't gone up before. And people walk around thinking that a blood pressure of 120 is normal, when in fact 120 to 129 is considered elevated. That's kind of the warning your body is giving you. And greater than 130 over 80 is considered stage 1.
These machines aren't that expensive. They're 30, 50 bucks, something like that. So if blood pressure is something you need to be looking at, you could look into getting one of these. But let's go about setting it up now, because we're going to find out what not to do.
That's right.
And I'm your guy when it's what not to do.
I got it. Okay, yep. Okay, so the first thing not to do that Tom is doing here is putting it over his clothes.
Dummy.
It should be skin-to-skin contact.
Okay.
The second, if you look at the positioning here, you see that the blood pressure cuff is right over his elbow, when it should actually be over the bicep, so much higher.
All the way up.
Yes. Now, sometimes people...
And you want this tube right down
the tube needs to be lined up with basically the side of your elbow, because that's when the artery is running. It even is the artery line. Some people put it on the forearm, and that also gives inaccurate readings.
Okay.
Now, look at the tightness of the cuff. You have it way too loose. So that flap that hangs over should be about the amount of your finger. So you want it nice and snug.
Tighter.
Because if the blood pressure cuff is too big, then it's going to underestimate your pressure.
It's amazing this can get around my massive bicep.
It is. Yeah.
Now, if he had his legs crossed like me, you would say...
But look what he's doing.
Oh.
He's holding them together.
Oh, don't do that?
He's got his arm hanging down in his
this.
lap or holding it up. He needs to be resting it on a table.
Does it need to be level, or can it be?
It needs to be level, resting on a dining table or a desk, because if you're
So I
hanging
can't really
it down,
do it here.
this will overestimate by about 4 points, or 4 to 6 points, and in your lap is about 4 points.
So you want it
at your heart level.
Horizontal,
because you don't
heart
want more
level.
blood going into the cuff. Now, I don't want you talking. I like that you have your back supported. I don't want you texting. And
She likes this when you say you don't want me talking.
Yeah, zip it.
And you have to empty your bladder. So this is something we don't often think about.
Not while
I
you're
didn't know
wearing
that.
it.
Not while you're wearing
before
it.
you do that?
Right before you check your blood pressure. And then you sit quietly for 1 minute
Before you start
start doing it.
And so when you do it, if like say you get a bad reading, you're like, do you take it again right away and make sure that that was the reading?
So you do take it again, but not right away because of what you just did. So the minute you get a bad reading, you go, and then your brain releases chemicals that raise your blood pressure. So generally, I recommend wait about another minute and take it again in the same arm. And if you're still getting an elevated reading, you might want to check the other arm. And if it's still elevated, you write it down and you call your doctor.
I have a damage to my left arm, and they usually take it in your left arm. It's closer to your heart. Does it matter, right, left?
It shouldn't matter. Sometimes we have about a 5-point difference. That's normal between the arms. If you have more than a 5-point difference, that can be a problem. A lot of women that have had mastectomies, lymph node dissections, they can't take it in a specific arm. So if you're ever in doubt, you've had surgery, always check with your doctor. But to your point, Tom, always better to take it in an uninjured, non-surgically intervened upon arm so that that's better.
Because he had that bulging bicep. He did. He had a bulging bicep.
So, you know, we're making
That's
jokes.
not exactly what happened.
We're making jokes, but guess what percentage of Americans have their blood pressure controlled less than 130 over 80?
Oh, I'm sorry to say. You're saying who have it down under 130 over 80?
50%?
20 who have hypertension. And, you know, 6 out of 10 people know they have hypertension, which means 4 out of 10 don't.
We're out of time, but when you get this high blood pressure reading, I mean, the first thing you do is talk to your doctor.
Talk to your doctor. And if it's in the elevated range, just kind of keep track because it could get reversible. And if it's really elevated, over 160 to 180 for the top number, over 100 for the bottom number, that's an urgent call to your doctor because you might need to go to the ER.
Well, don't do all the wrong things. Leave that to me.
That's right. You can find all of this. You know, seriously, you got to save this because when you're doing it, pay attention. You can find more with Dr. Kohli on 9news.com/Dr. Kohli.